station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Hello, Cayman, and welcome to another episode of Healthcare Today with the HSA. I'm your host, Austin Harris, and it is a pleasure to welcome in studios my guests for the day. We have Miss Nia Prendergast, Patient Experience Manager, and she is joined by Miss Ellenor Kerr, Patient Experience Officer, and they both will talk to us about the new HSA Call Centre that is available to you, the patients of the Health Services Authority. Nia, Ellenor, welcome to Healthcare Today with the HSA.
Thank you.
Hi, good afternoon. Thank you.
Pleasure to have you both with us in studios. Before we begin with the main thrust of the conversation, I like to, it's a personal experience. We want our listeners to get to know our guests. So maybe you tell us a little bit about yourselves, your background, how long you've been with the HSA, etc., etc. Nia, we'll start with you.
Well, I am new to HSA. This is actually my first month. I started on the 2nd of January.
Okay.
So I've been in healthcare for over 15 years in the States. And so now I've moved back home to be with family. So okay. I'm excited to work with HSA.
All right. Well, welcome back home,
yes,
so
thanks.
to speak. Ellenor, likewise to yourself, tell us a little bit about your background.
Hi, I've been with the HSA since 1997. I came over to Cayman with my husband. I'm a registered nurse, and I have worked with the HSA in various departments. I started off in the old hospital as an RN, and then I stayed there, basically with working there between medical and CCU, and then I became one of the nursing supervisors, and then I got offered this job to move to patient experience, and I decided to take it, and I have been there since 2018.
Oh, fantastic.
So
well, you're practically family then, aren't you?
Mm-hmm. Absolutely. This is home.
This is home. Well, good, good. Well, lovely to meet you both, and lovely to have you in studios to share with our listening audience today. Exciting details about your call center. I guess the obvious question to begin with is, what is the call center?
The call center is, we decided to open this call center where you can phone to make appointments, or you can phone if you need some advice, whether it be how to navigate the HSA, or whether it is you have some symptoms, or you need to just know what, if you're looking for guidance as to what to do if you've never been to the HSA. We have a clinical line which is on our calling tree. Our calling tree has changed recently, so we're asking all listeners that come to the HSA, if you do call in, to listen carefully and then pick the appropriate number. For the clinical line, it's option number 2. So it is. For appointments, it's option number 1. But the actual call centre is where we're all based, and we have what we call officers that are purely just for appointments.
Okay.
And then we have officers like myself, that have got a medical background. So as if you're phoning up to try and navigate the HSA, navigate through whether it be making your first appointment or where you should go, or if you need some advice with medication, we have an officer on the line from 7 a.m. to 7 p.m. So we do. So that's really what the call centre is. It's to try and have like a one-stop shop, so as everybody knows, exactly what they've got to do when they get to the hospital.
All right.
And the appointment side of it is really to help our patients and clients, because it's hard to get appointments.
Sure.
It's hard to get appointments. And again, they are open from 7 a.m. to 7 p.m. There's a few clinics that we might have to transfer you, but you should be able to phone up and make an appointment for wherever you need. So part of it is to make the patient's journey to the HSA a lot easier.
Sure, indeed. 7 a.m. to 7 p.m., is that 7 days a week?
At the moment, it's just Monday to Friday, but, there are plans for the future for it to be opened over the weekend as well.
All right. And again, the next question might seem obvious, but, there are no obvious questions. Why did the HSA decide that a call center was something that they wanted to add to their list of offerings for their patients? And certainly, how will it improve the patient experience?
I think one of the reasons they did it is because patients were finding it hard to make appointments. And patients were also finding it hard to navigate through the system. It's a hard system to navigate, especially depending on your insurance, what it covers, what it doesn't cover.
Right.
And we were having a lot of issues with cancelling, rescheduling appointments. And one of the reasons they started, we're calling it the clinical line, is for patients to be able to understand about their health, what they should be doing. Because you go to the doctor and then you just walk out, you maybe don't make an appointment, but you've just done lab works. So it's all to do with that. It's to help the patient's journey be a lot more seamless when they're going to the HSA.
Okay.
And if they do call, if the person on the other side can't answer the question, then we're going to find out and call you back. So we are. It's to try and make it an easier journey, because it's hard and your health is very important.
Yes.
It's just as important as your bank account.
Sure.
And actually, in fact, more important than your bank account.
Right.
And sometimes we don't realise when things aren't going well.
Right.
We've been to the doctor said X, Y, and Z, but then we don't follow up. So part of it is this is going to make it easier for the patients to be able to follow up and keep on that journey, so as that they maintain their health at the standard it should be maintained at. Right.
We were chatting just before the program began, and whilst I guess we could say it is a relatively new service, but in fact the call center has been in operation for a little while now, yes?
Yes, it has. We had what you'd call a soft launch, and now we're really trying to push it out to the public so as they know that it's available and where they should be calling if they need an appointment or if they need some advice, where they should actually be calling.
All right.
And to save them to come up to the hospital as well.
Sure, indeed. Yeah. Have you had any initial feedback from the patients who've utilized the service so far?
Yes, I think that it has been widely welcomed. I think especially on the emphasis on appointments and wait time, people being able to call in and get that personal touch of, us not just transferring you to another department, to kind of speaking you and walking you through the process and making sure that, we close the loops and follow up with you afterwards to make sure that your services and your needs were met.
Okay, I see. Now, you mentioned in your, I guess, opening remarks the wide array of of service offerings that the patient center, the call center provides to patients. But maybe we can break it down, a bit slower. What are the services offered through the call center itself? We talked about appointments. We talked, a little bit about scheduling the right doctor in the right location. What else?
So maybe even just going through instructions that you were given. Sometimes you don't know who to call. You were just discharged from the hospital, or you were discharged from urgent care or A&E, or you maybe even just didn't understand sometimes, or just want some reiterating, or in lay terms, all that medical mumbo jumbo that you may not understand. You can call in, and since we have clinical persons on this line, they'll be able to tell you, they can't give you specific information on your clinical, but they can guide you in general questions, or even assist you in getting back to that department that you left,
Right.
to have your answer, your questions answered.
Sure.
So yeah.
As a end user myself from time to time, the HSA has also introduced, which I think is something new, but maybe it's not so new. They've started to email patients. Like in my case, I need a reminder that I'm going to see the doctor, otherwise I might not go. But they send regular emails as part of that reminder process. Are the two connected, the call center and the email appointments?
The email, the reminders are automatic.
Okay.
That's an automatic system. But again, if you can't remember when your appointment is, if you call up and you go to appointments, or you come through to the clinical line, we will be able to check for you. And also, the other way of being able to find out if you've got appointments coming up is if you sign up for our patient portal. And that your upcoming appointments are all for view on the patient portal.
Okay.
Might talk about the patient portal a wee bit later.
Yes.
About what it actually offers, because it's a good service.
Indeed.
But yes, that is fairly new, that we're trying to send out emails and not do the telephone calls. You will still get some telephone calls for some of the clinics until we get the systems all up and running and everything's connected with the appointments.
Gotcha. Talk to me a little bit about the individual training that you put your, patient experience officers through in order to manage the calls. One question comes to my mind: is English the only language in which you communicate, or are there bilingual staff that can deal with persons who perhaps might have English as a second language?
Well, as
English,
of right now, English is our only language.
We
yes.
do have
a language line.
A language line, so we do have that on our computers where that can help us be able to translate for the patients if they do require.
Have we had many of those calls?
No, we've not really had a lot of calls. Most people speak English, but if we do need it, we've got a thing called language line where it helps. That's available in the whole hospital wards and everything as well.
Right.
In case we have people in that don't speak much English or don't speak any English at all.
Right. Now, Ellenor, you mentioned that you have a nursing background, which I would imagine would be extremely helpful from a call center perspective. Are you unique amongst the team of professionals, or do all of the call staff have some degree of healthcare backgrounds?
We don't all have backgrounds, but our officers that will be on the clinical line will all be RNs.
So we're staffed with half officers and half assistants, patient experience assistants, and so the officers are the clinical staff, and they mostly have medical backgrounds.
Right.
Yeah.
Well, the reason I ask is that on the one hand, if I have an appointment, then obviously I know my doctor. I'm familiar with what's wrong with me and obviously how to fix it. But what about those patients who are calling to make an appointment? They have symptoms, but they really don't know which doctor to call.
That's why we've got our officers have some clinical background, so as we can walk them through the system at the HSA, because although you might have a sore tummy, or if your toe's hanging off, you're going to come to A&E, okay?
Right.
But if you've maybe just got a sore tummy and you're not sure where to go, they can call like the 949-8600 number, pick option 2, which is going to get through to one of us, and we'll be able to guide them whether they need to make an appointment for the GP because it's not, 9 out of 10 and it's not every day, or they need to come to urgent care. We'll be able to direct them to the right place, or if they need to come to A&E. That's one of the sort of rationales behind having the clinical line.
Yes.
If people are really unsure what to do, then we'll be able to tell them. Even just navigating, if they've never been to the HSA, the first place you should really start with a doctor is a GP appointment.
Right.
And even if they call us, we have been trained to make some of the appointments. So we'd be able to help them walk through that.
All right. Well, that's encouraging. The telephone number for the call center, is it the standard HSA number, or are there special numbers that you can reach out to specifically?
No, it's the 949-8600. It's option number 2.
Okay.
Our call-in tree has changed, so that's why we're encouraging everyone to listen to it, because appointments is definitely 949-8600, option number 1.
Option number 1.
Yeah.
All right.
Yeah.
Well, we need to pause and take a short commercial break, but there still remains a lot more healthcare today with the HSA to come, including further conversation with our guests, Nia Prendergast and Ellenor Kerr. We are chatting about the HSA Call Centre, a new and exciting service that is being extended to you, the Health Services Authority patients here in the Cayman Islands, to make your patient experience that much easier. So don't change that dial, but instead stay right where you are. There'll be more healthcare today with the HSA coming up next, right here, only on Bobo.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And welcome back, Cayman, to Healthcare Today with the HSA and our guests in studio, Patient Experience Manager, Miss Nia Prendergast, and the Patient Experience Officer, Miss Ellenor Kerr. And we are chatting this afternoon about the HSA Call Centre, a service has been in existence about a year, but as usual, perhaps you, the patient, perhaps may not know about it. But certainly after today you will, and hopefully you can call us and tell us about your experience with the new call center, which is designed to improve the overall patient care at the HSA. For the benefit of the listeners who may just be tuning in to the conversation, maybe we can recap a little bit about the call center, the telephone number that would be utilized to call it, and again, just a quick recap of the services that are provided to your HSA patients who would otherwise use this new service.
Yes, so we are a call center of HSA that is manned by the patient experience officers, and we are available from Monday to Friday from 7 a.m. to 7 p.m. by dialing 949-8600, which is the main hospital line, and pressing option 2 at the time, but please still listen because the options may change at any time. Right now, 1 is for appointments and 2 is to reach the patient experience team. We assist in appointments, so if you can't get that option 1 or it's busy, you've been trying for a while, you can hang up, dial again, and dial option 2, and then we can walk you through. Our officers are there to make appointments for you if you need it. We also navigate you through services such as which doctors to visit, which clinics are available to you. When you come into the hospital, who to see first. We may even give you information on care sometimes based, not clinical information, but basic general information about what services are given and what you may need, like Ellenor was saying earlier about if you have a stomach ache, as opposed to if your knee has been swollen. So those two things, you may not know what type of appointment to make. You don't know if you're going to see ortho, if you need to go to A&E, if you need to go to urgent care. So those are some of the things that you can discuss with our patient experience officers, and they can assist you with information. And just all around, personal touch, almost like a concierge service, I think of it as. And you come in and they're very pleasant, and they actually do greet you at the info desk, because one of my officers or assistants are at the info desk when it's open. Right now it's open also from 8 a.m. to 8 p.m., but we're trying to expand those hours as well. And so, just when you come in, just look for us in our lavender shirts, and someone will assist you.
All right. And again, the service is available from 7 a.m. to 7 p.m. Monday through Friday.
Yes.
All right.
For now.
For now.
Yes.
For now, but that may be expandable possibly to
Based
more
on the
days of the
needs.
week based on needs and, of course, patient feedback. So if you are a patient and you are utilizing the service of the patient call center, by all means, share your experience with either your patient experience officer or patient experience manager, and that obviously will help the HSA further tailor-make this and other services to obviously provide the best service to you, the patient.
Correct.
Let's talk about patient security as it relates to general healthcare information. How do you train and plan to maintain doctor-patient confidentiality when dealing with persons on the phone lines? I'm thinking, for example, I have an elderly parent, and I'm booking an appointment for my mother, for example. Oftentimes I'm asked to go to the pharmacy and pick up, medications and whatnot. And they oftentimes ask, are you the patient? No, the patient is clearly female, and I'm definitely male last time I checked. But how do you address the whole patient confidentiality aspect of your job?
Well, as we all know, the HSA is a JCI accredited institution, and we do have robust security measures in place. So if you are calling in, for example, to make an appointment for your mother, we would need her date of birth and her name.
Okay.
Same at the pharmacy, they're going to want 2 identifiers, sometimes 3. We might ask for her telephone number that's on file. But all staff have to sign a confidentiality agreement at the HSA. So we do have strict privacy standards, and we meet the regulation requirements that JCI and the law want us to have. So it's normally 2 identifiers. So we would never not make an appointment for your mum, as long as you know her date of birth and her name, which I'm sure you do.
Yeah, definitely. Yeah. I might know her name before I remember her date of birth, but that's bad son.
That's I mean, another identifier is your MRN number as well.
Yeah.
Which is your medical record number. A lot of people in Cayman do know their medical record number. I don't know mine. It's just one of these things.
Docket number, I think we call it.
That's it, docket number. Well, that's what it used to be called.
What's it called now?
Your MRN, your medical record number.
Okay. All right.
And obviously everything's like digitalised now at the HSA, so we've all got our own docket numbers. So we do, which are all specific to us.
All right. How many call handlers for that, or officers do you have in that call center working at one time?
At the moment, we've just got one. Due to the volume of calls, it's not been overly busy.
Yeah.
But the more calls we get, then the more officers we would add. And as we said, they'll always have like a clinical background. So we won't give any clinical information over the phone.
Yeah.
But if there was a problem that we couldn't deal with, we do have clinicians, we do have medical doctors that we can phone,
right,
and they can either advise us or they might just take the patient's details and call them directly.
Okay.
So they might. So there's always going to be a medical doctor that is going to be on call for that clinical line that we'll be able to call if we really don't know how to deal with the situation. Because there can be situations that we just might not know what to deal with,
Right.
or how to deal with it, or where to tell the patient to go. So we'll always have a doctor
I see.
on call for us. Yeah.
Okay.
But as the volume of calls increases, then the more officers will be available.
Let's just take a hypothetical. At the moment, you've got one patient experience officer answering the calls. And perhaps that may have been your experience for the past year. But say Wednesday, out of the blue, now you're being inundated with calls on a single day. How do you manage that heavy traffic with only one officer? Is this something that are you flexible enough to be able to add persons on the fly, or is it something that requires planning?
No, we would definitely be able to add one of our officers. Our call centre is not based at the HSA, but obviously we're in touch with each other. So if I was inundated with calls, if I was working that day, I would just phone Miss Nia and say to her, you need to pull one of the officers to log into the clinical line, and we can literally do that from any phone, like at the HSA.
Right.
So that wouldn't be an issue.
Right. Okay.
It would just be like for myself knowing that I was inundated, and with it being the call centre, the supervisor for the actual like switchboard and everything, they would be able to tell that we were having drop calls, we were missing calls on that particular line. So she would alert me, and then we would alert Miss Nia, so as we can pull one of our officers. So yeah, we'd be able to deal with it. A bit like when we had the flu hotline. I was one of the people that was on the flu hotline. I get pulled to do that.
Terrific.
So, there was days where we just had to pull people because it was so busy.
Sure.
As we know, we all know what it was like during COVID.
Well,
It's a hard
certainly,
time.
yeah, no kidding. Now, speaking of which, I think, so was a call center sort of implemented at the tail end of the COVID pandemic?
Yes.
Because I can imagine certainly how useful it would have been, certainly, say, 2020, when COVID first, found its way to our shores and the questions were everywhere.
So we implemented the flu hotline at that time. I think we shut down on the Sunday, and that was the first day of what we called the flu hotline at the time.
Yeah.
But yeah, it really has come from that. It really has come from when we had COVID, that people were phoning up and asking questions, and they weren't always just all about COVID. And I think that was one of the visions that they had at the HSA, because it had been such a success during COVID that we felt this would be a good thing to implement.
Right.
You know.
Indeed.
Because during COVID, people didn't know where to go.
Yeah.
They didn't know what to do. So, and at that time, there was 5 of us on the flu hotline.
Sure.
I mean, it was exceptionally busy. It was different circumstances. It was COVID. But yes, definitely, that's where it came from.
Well,
That's
certainly,
the idea.
let me, on behalf of your patients during that time who utilized your services, thank you for having that service available, particularly during the COVID pandemic, which, as you say, it was a once-in-a-lifetime experience for all of us. Which is interesting, though, and not wishing to call anything down from the heavens, but, in the U.S., for example, you've got bird flu that they're tackling with right now. Thankfully, so far it hasn't found its way to the Caribbean, but should we ever have a pandemic or influenza that is nationwide, again, we can see how easily convenient having this call center would be for patients.
Absolutely.
Correct.
The one thing I would say is, in Cayman, we did a good job.
Yeah.
I think we could all be proud of how we managed the Cayman Islands during COVID. It was a hard time for all of us, but
Yes.
it's one thing I will never forget.
Yeah.
And feeling safe and secure here.
Yes. No, I would 100% agree with that sentiment, and yeah, we should be proud of how we came out of
Yep,
that.
absolutely.
If there were ever any doubts about the quality of healthcare in the Cayman Islands, you simply go through COVID-19 and you quickly realize a much greater appreciation for the hardworking men and women that make up the Health Services Authority of the Cayman Islands. I'm certainly grateful that you're there.
Thank you.
Talk to us very quickly before pausing to take the next commercial break about you mentioned earlier on the calling tree and listening to the recordings or what's being said. So when I call the number, I'm not getting, for example, you directly. I'm getting a messaging system that'll then direct me to select one or two, and then I might get a live person, or do I get a live person right off the bat?
So you get the number. When you call the main line, you get the welcome to HSA. Our options may have changed, but dial 1, press 1 for appointments, press 2 for the patient experience. I don't go past that, but it may be press 3 to speak to, dietary, or press 4, those type of options. So it is not a direct line. However, there is a direct line. So if there is something that is pressing, or if you spoke with someone already and you need to follow up, Ellenor might say, look, because again, patient experience is important to us, and just the whole, it's not just showing you where to go and then sending you on your way. I urge my staff to kind of walk people through the process and make sure at the end of that they were able to make that appointment, or they were able to speak to that doctor, or they were able to get the services that they called in for. So they may give you a follow-up number to call the patient experience office, and once you get that, you can call and kind of follow up.
You'll always get a live person on option 1 and option 2. You'll always get a human voice. You're not going to get a recorded message.
Well, that is also extremely comforting.
Right.
Well, that was another reason we started the call centre. We were taking feedback from the patients, and one of the biggest things we heard was you don't get to speak to a real person. You're not hearing a live person on the end. You're just going from option to option. So that was one of the reasons. So option number 1 and option number 2, you'll have a real person on the end of the phone answering your questions. And again, if we can't make the appointment for you, we'll take all your details and we will get back to you, because one of the reasons for the call centre is to close the loop. One of the reasons is not just to hand you over to someone, it's to actually close the loop. Doesn't matter whether it's appointments, whether you're looking for medical records, whether you're just looking for visitation times, whatever it is, we'll always try and close that loop for you. Might not be that day, we might have to get back to you the next day, but we will try our best to close the loop so you'll have an answer.
And even when we're not available, because it isn't a 24/7 line, even when we're not available after 7 p.m. or before 7 a.m., it will redirect you back to the operator, and then she will then give you, or he will give you information regarding how to contact us, because we do have an email, we do have a telephone number.
Right. Okay. All right. Well, we're going to pause, take another short commercial break. But when we come back here on Healthcare Today with the HSA, I want to talk a little bit. We touched on it. We just breezed over it and didn't talk about it. But I want to talk about the My HSA Patient Portal app. As they say, there's an app for that, and there's an app for this. And you get to find out about that app when we come back. So don't change that dial, but stay right where you are. There'll be more Healthcare Today with the HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
And welcome back, Cayman, to Healthcare Today with the HSA. And our guests, Nia Prendergast, Patient Experience Manager, and Ellenor Kerr, Patient Experience Officer. We are chatting about none other than the exciting new service that certainly makes going to the doctor all the more easier. That is, of course, the new HSA Call Centre. Now, before the break, we talked about a great many things, and I'm hoping to recap on a lot of those for those listeners who may just be joining us. But we talked about there being an app for this, the My HSA Patient Portal app. How does that run as a good, shall we say, partner to the call center?
Well, first of all, you have to sign up for the app.
Okay.
And we're encouraging everyone when you come in and you have an appointment or even at the info desk, if you just ask to sign up to the My HSA Patient Portal, they will ask for your email address. You'll get an email back in and then just follow the instructions. And then you download the app onto your phone and you will have secure access to some health information. Like if you have been to the doctor and you've had your blood pressure done, or you've had some lab works done, or x-ray, these will all come in, the results will all come into the app. So they will. There are definitely some results that might not be uploaded, especially if they're quite sensitive. That might require you to, come back and speak to the doctor, but they're all there. And again, if these results come into your phone and you're not 100% sure of what it actually means, that's another reason we're asking you to call the call centre, because our officers there will be able to walk you through it and help you understand some of the results that are there. So the first thing you need to do is sign up for it, and you can do that at any of our registration places at the HSA. It also means that you have 24/7 access to your health records. You can also request some appointments for the general practice and pediatrics. You can add your child to the portal as well, so you'll get their results, but only from the age 0 to 16. They will drop off at the age 16.
Okay.
So they will, and they'll have to get their own portal.
So when they become an adult in the eyes of the law, then you're off mommy and daddy. Now you're doing it all by yourself.
They might still have to sign your consent form if you're going for an operation till you're 18, but for the portal, they will be off that. So as I said, you'll be able to see sort of general results like radiology and some lab works and stuff, and all your immunisation. Obviously, one of the reasons the portal was started was at the end of COVID, when we had to show our QR codes when we were travelling. So that will still be there. But any of the other things, like if you've been immunised, and some of your health history will be there as well. So you'll be able to access that. And you can do your refill prescriptions there as well. So you can. But we also, for the pharmacy, we also have a WhatsApp for refills only. Yeah. And you can just WhatsApp the pharmacist with what it is you need. As long as you've got refills on your bottle, and the refills are always in the right-hand corner, I'll tell you. The right-hand corner. But the number for that is 925-6534. That's a handy thing to have as well for the refills.
Sure it is.
And also, we also have on our website, you can do all this on our website as well. So if you don't, you can sign up for the portal, but if you don't have it downloaded onto your phone, if you have a computer at home, you'll still be able to see all that. You'll still have access. But the website, our hsa.ky website, that's another great place to go, where you can see all our doctors.
Right.
And you'll see what we offer, what all our doctors do, whether they're a cardiologist, whether they're a urologist, whether they're a GP, whether they're a gynecologist, and there's a short bio about them. And you can do lots of things on our website. You can make appointments, you can ask for your medical records to be printed. You can, again, see like general information about your health, but only if you've got like the portal. So it's another good tool. It tells you about all our hours for the clinics,
right?
Where our clinics are, because obviously HSA, we don't just have clinics at the HSA, we obviously have our district clinics as well. So it tells you all the times that the GPs are available there, and when the nurses are there as well.
Okay.
So that's another good service that we have.
Yeah.
that
No.
works hand in hand sort of with the call centre as well.
Indeed, indeed. Well, again, the call center is available Monday through Friday. It is open 7 a.m. to 7 p.m. And we keep talking about the list of services that are available to you through the call center. Whether you need to make an appointment, yes. Whether you need to check your labs, if you had a blood test, for example, and you got to check your hematology doctor. Is that right?
Yeah. If you want to check.
Yeah, Dr. Lundy or Lundis or what's his Richards.
Dr. Richards.
Dr. Richards. Yes.
Yeah.
Well, I was chatting with him last week, and
right.
we had a great little chit chat. So that's the only reason I know that. I'm working on my side medical degree. Really, it's I do it on the weekends. I'll be a doctor in 2 years.
No time, yeah.
Excellent.
Excellent.
We always need
Excellent.
doctors.
Indeed. Again, patient confidentiality we touched on, but a reminder to the listening audience that, so the call center is available to you, the patient, but you can also call, as you said, if you're a parent calling for your child, if you're a child calling for your parent. There's certain bits of information you can use, but at the end of the day, patient confidentiality is still number one on your list, yes?
Yes,
Absolutely.
and we don't necessarily give out clinical information, so don't get mad if you call us and ask certain questions and we can't answer them, but we will definitely direct you to the proper person that can answer those questions.
Okay. All right. I'm trying to think of how else, or is there anything else that we've not touched on so far? I think we've squared the circle in every respect.
Yeah, I think I would just another introduction to the patient experience department by just stating again that we are lovely young ladies. We haven't had any gentlemen join the group, but we definitely welcome them.
Okay.
But for now, we're in our lavender shirts. So if you do see staff in lavender shirts, that feel free to approach us.
Right.
And make sure, you ask us whatever questions that we need, or if we see that you look a little perplexed, we may walk up to you. Don't be disturbed, just to ask you if you need any assistance and to give you some guidance.
Mm-hmm.
We're usually located in urgent care, especially during very busy times. We're in A&E waiting area, assisting patients to get through that process so that is seamless for them. We are at the front desk, so you might see one of those lovely young ladies at the front info desk giving out visitor passes,
Yes.
which they're heavily enforcing right now, that you bring your ID or your passport. You can even take a picture of it on your phone
Okay.
and bring it in, but we are trying to strictly enforce to have IDs be shown in order to get visitor passes.
Okay.
And they also walk around to different waiting areas. They're even at our clinics, and we're trying to expand to the district clinics as well to just help navigate, give patient information and
Right.
experience, take the patient experience.
And also get feedback from the patients, what they want to see, because it is their HSA, so we want them to give us feedback on how we're doing, what we're not doing right, what we are doing right, how we can improve the HSA to make it more seamless, or going to the hospital is never a pleasant experience, even
Yes.
just going to the GP. You can be anxious and stuff, so as Miss Nia said, if you see us in our lavender, or sometimes we wear pink, please don't hesitate to stop us. And as Miss Nia said, please bring your ID, because very shortly you won't be able to visit the HSA unless you give your ID at the info desk. You won't be allowed through the front doors. We're going to have visitor passes that has your photograph on it.
Oh, yes, I read about that. Yes. No, okay. No, it just dawned on me. You have the regular number, which is 949-8600, but don't you have an 800 number as well? And if so, is the patient call center accessible if dialing the 800 number? I see the look of confusion.
I'm not aware of an 800 number.
Yeah, 1-800-534-8600 is the
one.
number. Yeah, it
It's still-
just kind of light bulb went off.
I think it is the same. I think that's just a toll-free one for people that don't have any
outside.
credit on their phone, or
Yes.
they need to do that. Yes, they can do that, and they'll get through
The same
to
number.
to the same options, the
All
same
right.
option menus. And also we do have an email address, which is info@hsa.ky.
Yes.
And that actually, it's the patient experience team that monitors that email. So if you've got a question, a query or something, don't hesitate if you want to email us. If we can't answer the question, we'll certainly forward it to the relevant department, so as we'll get an answer for you. Again, it's trying to close the loop.
Sure.
The
Sure.
patient experience team's all about making the patient's journey a lot easier, a lot more simple.
Yes.
But we also want to hear feedback. We want to know what you want us to do. What would make your journey at the HSA a more seamless process?
Quite right. Quite right. We talked earlier on about, and this service was made available on the tail end of the COVID pandemic, but thankfully that's in our rearview mirror. But what about because you used to have a flu hotline. Does the call center take the place of
Yes.
the flu hotline now? But the
Yes.
flu hotline is still, that's a service that's available because we have the
No.
annual flu season.
The flu hotline's not available. It's now 949-8600, option number 2, and you'll get one of the patient experience officers on that one. The same as everyone that's on the clinical line always has a medical background.
Okay.
So that's what that's for. Yes.
All right.
This is really taking the place of the flu hotline.
Yes. All right. Well, Nia, Ellenor, I want to thank you for coming in today and sharing all of your valuable information with us on the call center, its usage, how easy it is to make contact, and of course the raft of information that is available. Certainly does make going to the hospital a lot more enjoyable and certainly a lot easier. And I thank you for making this service available to your patients. I'd like to give each of you an opportunity for any closing and or final remarks. And Nia, since you carry the manager title and you're the boss, I'll give you the last word. But Ellenor, maybe you can start us off.
Just want to say, if you've got any problems or anything, please don't hesitate to either stop one of the patient experience team or call us on the regular hospital number and pick option number 2. And my final thoughts are that Cayman should be proud of the HSA. We've come a long way.
Yes.
And it's a great service.
Yes.
Fantastic service. If you can utilise it properly, and this is what we're trying to do.
Yes.
We're trying to close that loop, and we should be proud. We should be proud as a nation.
Yes. No, I would definitely second that. Again, not being a spring chicken myself, but being from here, I remember the HSA when it had its wee bit humble beginnings.
Yes.
And certainly, I've said it all the time. Now, there was a time when if you had, anything greater than a flu, you would want to see a specialist, overseas.
Absolutely.
But now,
Yep.
every single day, there's a new service being provided, all in-house. And not only is that convenient for you, the patient, but let's not forget about our support systems, a family, closer to them.
Absolutely.
And that's where the whole healing aspect takes place. So I absolutely second that statement that we have nothing but pride, or should have nothing but pride, for the Health Services Authority. And you have lovely people, professionals like Ellenor Kerr, they're providing these services.
Yeah.
We appreciate it.
We have come a long way.
Yes, you have come a long way,
Yes.
baby, as that old commercial would say. But I mean that in the most professional way, of course.
Absolutely.
Of course, absolutely. Nia Prendergast, thank you as well for being our guest in studios, an opportunity to share a bit of the final word, as they say.
Yes, thank you for having us. We're very excited to share this information about our Call Center and the expansion of our patient experience department. You know, we're here for the community and we look forward to serving. And it, again, like Ellenor said, if there are any issues, please, you can even ask for me by name. If you're having an issue with something, then you feel that you aren't being seen in the way that you wanted to be seen, just let them know and I'll come down to assist you.
All right. Well, again, Nia Prendergast, Ellenor Kerr, thank you very much for being with us. We've been chatting about the new HSA Call Centre. The hours of operation, again, at present, is Monday through Friday, 7 a.m. to 7 p.m. To access the call center, all you have to do is know the number for the hospital, which is 949-8600, or you can call toll-free at 1-800-534-8600. And, of course, you will listen to the recording, listen to the automated message, but press number 2 at the moment, then you'll get forwarded to one of your professional call center phone handlers, and they will direct your call to, obviously, where it needs to be. If you have additional questions or follow-up, of course, the email is available to you at info@hsa.ky. But that's all the time we have for this episode of Healthcare Today with the HSA. Again, I want to thank our guests for being in studios. Ms. Prendergast, Ms. Kerr, thank you for being with us. To you, the listening audience, we want to thank you again for taking the time to tune in. These days, you have many options in which to choose from in terms of how you spend your radio time, and we want to thank you for tuning in every Friday and Saturday at 1 p.m. here on Bobo FM to learn more about the services provided by your Health Services Authority. I'm your host, Austin Harris, thanking you for taking the time to be with us and encouraging you to tune in again every Friday and Saturday at 1 p.m. for Healthcare Today with the HSA, brought to you exclusively by Bobo FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.